So I work with the Domestic Violence Action Center. We are a standalone agency devoted to addressing the problem of domestic violence, which is unlike our community's other domestic violence programs. Those are programs that are embedded in larger social service agencies. It's just a different way of lifting up the problem of domestic violence. For us, we can take positions, we can advocate in ways that are important for our constituencies and for our community allies. We work collaboratively with our community-based organizations, our domestic violence shelters, our healthcare practitioners, our law enforcement community, our courts. The work we do is life-saving and certainly life-altering. There are 50 of us on staff. We started our work about 30 years ago with 2 part-time staff and have grown to enhance our agency's work with new programs that we recognized through the work we were doing with individual island families. For example, we added specialized advocates. So what that means is we have a Japanese advocate, Korean advocate, Kofa advocate, Filipina advocate, Native Hawaiian advocate, LGBTQ advocate, because people are most comfortable and best served by somebody who understands their community norms and speaks their language. So we added programs. Our most recent program is housing. When we talk about the problem of domestic violence, or when we listen to other people talk about the problem of domestic violence or homelessness, we don't hear them addressing the needs of survivors who have fled or escaped. We hear almost the entire homeless problem described as impacting people with mental illness or people with substance abuse disorders, and not survivors and their children. So we've added housing to our array of program services. I don't know exactly how much all of you know about our work, which is why I just wanted to give you a little sense of what we do. Do you have the PowerPoint, or shall I just?
It's up to you. I can share them for you, or if you prefer to share it yourself.
I would love it if you would share it, if you don't mind.
Sure.
I'm not.
Maybe get that set up.
I'm sorry.
No, you're good.
So it is our belief, our experience, and our conviction that safe families are at the core of a healthy community. And what that means to us is if people are not experiencing a safe relationship or a safe environment, if their children witnesses, for example, do you want to? Okay, there we go. They are likely to carry their experiences into their workplace, into their school, into their church, into the marketplace, basically. So as a community, we have an investment, we ought to have an investment in making sure that families and partnerships are safe and free from coercion. I'm going to do a little disclaimer here. I'm going to be referring to survivors as she and perpetrators as he, just for the sake of ease and vocabulary. But we serve anyone who is a victim or survivor of domestic violence, men and women. So all of our domestic violence programs in Hawaii do as well. But it's just easier if I'm referring to the victims and survivors as she. So this is basically our vision, that women, children, and men will be safe and free from harm in their homes and in their relationships, and have the freedom and the ability to make positive choices about their lives. This is not the case in relationships which are characterized by or defined by domestic violence. So I'm pressing the arrow. Do you have to do that, Summer, or can I do it?
I think Summer has to do it.
Oh, I see.
You can just say next.
Okay, thanks. So please forgive me if you are acquainted with all of this content. Stop me if I am being redundant in terms of your work or your life's experience, but I just wanted to kind of set a foundation for you from where we come from, what our approach to addressing.
I don't think you can hear this too many times.
Okay.
Unfortunately.
Yeah, thank you. So this is pretty much the definition that all of our communities, domestic violence programs use as guiding principles for understanding who's coming in their door and what they might need and how best to provide them information about their safety. So it's a pattern of behavior that one person uses over the other person in order to establish control and maintain that control. Now, it used to be, and maybe this is a little bit better understood now, although I'm never quite certain, it used to be that domestic violence really meant physical violence. If somebody had a broken bone or lacerations or a bruise or an injury, we would label that domestic violence. We're going to get to this in a moment, but the power and control wheel is the tool, the instrument that we use, which includes a variety of tactics that are part of the pattern used by is it okay with you guys if I answer the questions that come in, or do you want me to do this at the end, or what works for you guys?
It's just been me doing that, so don't worry about it.
Okay. Okay, all right, okay. So there are threats, isolation, economic deprivation, psychological abuse, name calling, sexual violence. All of those can be ways that the partner establishes and maintains control over his partner.
There is a question though. Do people only usually exert domestic violence against one person they know or live with, or just anyone in their path?
It is mostly the person they know and live with. Very often, we use that as a way of explaining that it is not a loss of control, because they're not assaulting their boss, they're not assaulting their professor, they're not assaulting their healthcare provider. They are only assaulting their partner and maybe their children behind closed doors. So it's a very deliberate way of exercising the control that they have. Now, when we get to the power and control wheel, you'll see that the physical and sexual is the surrounds the tactics. It looks like a wheel. And that means, and that is a way of understanding that all these other tactics can be used without resorting to physical battering. They're much harder for the practitioner to see, for the lawyer to see, the police officer to see, the doctor to see, the nurse to see, the social worker to see. But those things are often in play in the relationship, which is why it's important for us to ask direct questions and name the behavior, or invite them to name what they're experiencing in the relationship. The person who is the victim of their partner knows that if they have ever been assaulted, there is the likelihood, or certainly the chance, that they could be physically harmed again, which is why they're going to be working very hard to be compliant and cooperative and responsive to the other tactics that are used, the psychological abuse, or turning over their paycheck, or not maintaining relationships with old friends or not going to holiday parties or whatever it is, because they know that if they are challenging their partner, there's a risk there. So yes, I'll come back to that. Okay, my question. Let me just finish this one slide and say that there are, it is a common question for people to be curious about whether domestic violence is mutual or whether it can be situational. Like after a person has had a stressful day, do they come home and assault their partner? This is not the type of domestic violence that our community's domestic violence programs are focusing on. Again, we are focusing on the pattern, the level of fear that a person experiences as a way of being supportive, conducting safety planning, and helping a person make some choices about how to achieve safety. All of us experience stress. We've had a stressful few years. Not all of us turned into perpetrators of domestic violence. So it is not a function of stress that is an explanation for why a person uses domestic violence in their intimate partnership. Next, please. So this is pretty obvious, but bears repeating. You can be married. You can once have been married to that person, former partner, lover. You can be a person who has a child in common with the perpetrator. You can live together without not having had children. You maybe have lived together in the past. Maybe you have a dating relationship or did have a dating relationship and never lived together, never married, and never had children. Of course, this is true for same gender relationships and heterosexual relationships. So let's move on to the next slide. Thank you so much for helping, Summer. So this is an opportunity for us to spend a moment to clarify the types of violence. I've already spoken about the pattern. That's the driving analysis that our domestic violence programs are using to shape programs and advocate for system change, or develop programs or support survivors who are lucky enough to find us. So resistance violence is a person fighting back. Maybe they have been assaulted and they're fighting back. Maybe it is not a person who has been a victim of physical assault, but they have been exposed to and tormented by all the other tactics, and they kind of have had enough and they fight back and express some resistance to the assaults, the verbal assaults or the psychological assaults or the sexual assaults that they've experienced. Situational violence, as I mentioned, there's no power and control. It's in reaction to a situation. We would not, for example, create a case at the Domestic Violence Action Center if there's one incident of situational violence. Our program services will really not be responsive to the needs of that person. Pathological violence is reserved for acts of violence that are due to mental illness, drugs, or alcohol abuse. But again, there isn't any power and control, which is the foundation for the partner violence that we're speaking about. Okay, what you've been waiting for, the power and control wheel. Can you move us to the next? Yeah, there you go. I can't see you all, so I don't know. I was going to ask a question, but how many of you have seen the power and control wheel? Lots of you, none of you, some of you, maybe just a little.
I know I have. Let's see if we can, how about put your thumb or your hand up or something if you've seen the power and control wheel before. with those little reactions with the smiley face guy on the bottom of your screen. Let's see. I've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 14. Oh, wait. 5.
Okay, let's just give us it just gives us an idea. Thank you for doing that. This is critical to our community's understanding of what domestic violence is. I just was participating in an interview with Hawaii News Now before I joined you folks. And we had a survivor also participating in the conversation. And she was sharing her experiences with her soon-to-be ex-husband. She was never physically or sexually assaulted by her soon-to-be ex-husband, but she experienced most of the other things on this power and control wheel. The importance of us as a community understanding this paves the way for us to provide the kind of support a person needs. So what this looks like, I'll give you an example, is let's say using isolation or using intimidation. If a coworker, let's say, used to participate in clinic or company parties, occasions, pauhana, birthday celebrations, and then has finds a new partner, maybe gets married, maybe moves in with that person, maybe has a new relationship, and they stop participating in these events. That would be maybe one red flag. We're talking again about a pattern, but that may be one red flag that we want to be mindful of. Why is that person no longer participating? Perhaps they're not permitted to. Maybe their partner is isolating them from their friends and family, or forbidding them, or limiting who they can communicate with or who they can socialize with. That makes for greater dependency, greater control. Again, this is a little hard to see, and if you're not paying attention, you could totally miss it. Maybe the partner is saying, if you go to that party, the door is going to be locked, and you won't be able to get in. You'll have to sleep in the car. Maybe the partner is using forms of emotional abuse and name calling. You're a bitch. You're a whore. You're why are you? You're not a good mother. You're not a good partner. If you keep going to your company holiday parties, and soon the person stops making that choice because they want to reduce the likelihood of potential physical assault, or they don't want to create an environment that is filled with tension and the energy attached to making individual choices and using their own personal freedom. Maybe their partner makes them, I think I mentioned this, makes them give them their paycheck. Or if they're a family, maybe all the family's assets are in the abuser's name. Or maybe that person is not permitted to use the credit card. Or maybe that person is not able to make decisions about where the family is going to go on vacation. There's a variety of different ways economic abuse can keep people dependent, can keep them isolated, and keep them immobilized, unable to make decisions about escaping. If I have nothing, what's going to be there when I escape? What am I going to rely on? Minimizing, denying, and blaming is very common. The abuser really doesn't acknowledge the abuse, the seriousness of it maybe. Acts like she did something to cause the outburst or the abuse or the fight, and again, the victim, the survivor, begins to take responsibility. If I were only a better mother, if I were only a better wife, if I had only made what I know he loves for dinner, if I had only been home on time, this wouldn't have happened. So these tactics are used to control the person, and it has a way of eroding a person's self-confidence and their sense of personal agency to make decisions for themselves or make choices that will carry them and their children, if they have them, to a safer place. We could go to the next slide now. Maybe you're able to share this if people would like to have a copy of the power and control wheel. One of the things that is the most frustrating for us at the Domestic Violence Action Center is that there are still so many myths and misconceptions about the problem of domestic violence. Of course, one of the most common is that this is a problem that occurs to certain kinds of families, in certain kinds of neighborhoods, in certain kinds of racial groups. Maybe there's the assumption that they're uneducated or undereducated or unemployed or using drugs. This is not our experience at all. Domestic violence is a problem that does not discriminate. We have helped many survivors who are working, who are middle class, who are upper middle class, who are in all kinds of neighborhoods, from Waialaiki to Waianae, Kailua to Kaneohe to Kahalu. This is a problem that touches all of our communities. Domestic violence is not loss of control. I think we talked a second about this already. The abuser, the person with the power, knows that they can't get away with assaulting their boss or their professional or their healthcare practitioner. So they may save their abuse till they get home behind closed doors when nobody can see them. Maybe there was an episode at a family party where the partner was talking to somebody else, and the abuser was infuriated by that. Didn't do anything at the party in front of everybody, but by the time they get home, she is assaulted for flirting or accused of sleeping with that person. Stress does not cause battering, as I have already said. We all have experienced stress. We experience stress on a daily basis and do not use violence or name calling or emotional abuse to control the person that we live with. During the pandemic, when we were seeing survivors living as prisoners of their partners, we were very frightened about the level of and the prevalence of domestic violence occurring. And the media and the community asked us a lot about, oh God, domestic violence is going up because people have lost their jobs or because they're under so much stress because of the pandemic. And again, we say it doesn't have anything to do with the stress that we're experiencing or the loss of a job that converts somebody into an abuser. There's a few other, let's go to the next slide. There's a few other myths and misconceptions I'd like to mention. They're on the next slide. Domestic violence isn't real unless a police report was made. Of course, this is not true. Many people don't see the police as allies. Maybe they've contacted the police before and the experience with the police was not helpful at all. Maybe they were harmed more seriously after the police came. Maybe an arrest was not made. Maybe their partner was arrested and prosecutors took the case and their abuser was acquitted. So law enforcement and criminal justice system is not the pathway for everyone, which is what makes your role and your wisdom and your ability to identify and provide information so crucial. I think we've talked to you a bit about this already. If there weren't any injuries or blood, is it domestic violence? Absolutely it is. We are still wrestling with this in many of the families that we are serving at the Domestic Violence Action Center. We have attorneys on staff who carry a divorce caseload, a restraining order caseload, and a paternity caseload. And many, many times, the courts are granting joint custody, which means the children are seeing and living with both their non-offending parent, usually their mom, and their abusive father. This is a mythology because just because a person does not hit the children or act abusively towards the children does not make that person a good parent. We hear children, and if you've ever read anything by someone who is an adult survivor of partner abuse, which means they grew up in a home witnessing domestic violence, they carry that trauma with them for their entire lives. The important thing to remember about this, two-parent families are best for children also, in addition to the way we suffered disappointment when children are expected to visit equally and have decisions made equally by mothers and fathers, is it is a variable that immobilizes survivors. They have been taught to believe, and the expectation has been clearly communicated to them that their children are better off with both parents. And moms want to make good by that. Most of us who've made a commitment to a relationship really want that relationship to work and want the best for our children and believe the promises to change and hold out hope that the relationship will get better and that there won't be any harm for the children. And so survivors stay in the relationship and stay in the household in order to support their children in the ways that our social norms are clearly communicated to moms. Men are not abused as much as women. When we think about socialization and the ways we socialize little boys and little girls, we teach little boys that they're to be brave and tough and strong and in charge, and girls that they're supposed to be nurturing and caregiving and supportive and accommodating. It's kind of a recipe for domestic violence. And it's not likely that women are perpetrating domestic violence as often against their partners. When we are serving male victims, most of the male victims, not all, but most of the male victims we are serving are victims of other men in same gender relationships. So men are still the ones perpetrating the domestic violence. Most of the data shows, and certainly our experience providing services to the community, are that the vast majority of women, of people who need help, are women. It is not uncommon for there to be assertions that women are making false reports or making up or exaggerating the domestic violence that they're experiencing. That is also not our experience. It is very, very embarrassing to be a victim of domestic violence. I'm not saying it never happens, because sometimes it does. But again, the vast majority of people who are taking the bold, terrifying step of disclosing the domestic violence are not making it up or are not exaggerating. In fact, to the contrary, they're minimizing the seriousness of the abuse as well. So it's real important for us, again, as a community, to not collude with the minimization of domestic violence by saying, well, she's just making false reports or misusing the process to get back at her partner. That really isn't our experience. Do you want to take us to the next slide, please? So there's a few other misconceptions I just want to raise. It's generally believed that leaving is the answer. If she just left, it would be better for herself and it would be better for the kids. Leaving is often not the answer. Survivors, I think the literature captures survivors' descriptions of stalking and harassment for up to 2 years after they have separated. Also, the time of separation is the most deadly for survivors. Most of the people who are killed by their partner are killed after they have left the relationship. So leaving is not necessarily the answer, which is why we suggest that you and all of our community allies encourage people who are thinking about leaving to call one of your community's domestic violence programs so that they can leave safely. It is not true that victims necessarily or always were abused as children, because they were not. I've heard people say that victims are sort of attracted to drama. I haven't met a victim who is attracted to drama or likes the drama. And again, I think I mentioned that victims rarely lie about the abuse. We've talked already a little bit about abusers can control their anger, and that stress, alcohol, and substances do not cause them to abuse. Abusers are not mentally ill. Rather, they are well-socialized males. And you can tell an abuser by looking at them. Sometimes I think I can, but I wouldn't say that's a rule of thumb. Let's move on to the next slide. I just wanted to include this, and maybe this is something you can share after we end our time together, but we did see things that occurred during the pandemic that are worth filing in your brain, because the pandemic isn't completely over, and the coronavirus hasn't completely gone away, and some of these tactics can still be used as a way of controlling their partner. Certainly minimizing, denying, and blaming is continuing. Like maybe it's his turn to have the kids, and the person he lives with has the coronavirus, and he's minimizing the risk of exposure for the children and insists on the visitation, even when mom is saying maybe it's not safe for the kids. So there's a bunch of things on here that we had contact with survivors who were saying that their partner was controlling their access to the internet. Now, people were working remotely from home, had to have access to their computer, their internet, their network, and it was a way of their abusers controlling and isolating them. So anyway, this might be something that you want to share further. You can move us on to the next slide. I just wanted to lift up for you that the incidence of abuse behind closed doors was dire during the pandemic. This is just one moment in time. So you can see that we as a community are now faced with post pandemic restrictions, people who experienced pretty serious domestic violence and are now exhibiting more significant trauma as a result of having been prisoners of their abuser and assaulted more frequently and maybe more severely as prisoners behind closed doors. So I think that is my last slide. I don't really know what time it is. This is my slide that says it's going to take all of us. We learned at the Domestic Violence Action Center some time ago that this problem is way, way bigger than we are. And it's only with the active engagement and the commitment and the investment and the community planning by all sectors that's going to make the difference. Elizabeth Kubler-Ross taught me that we are 7 generations behind at this point. The children who are currently living as witnesses in households where there is violence have a much greater probability, the perpetrators do, not the victims quite as much, but the perpetrators have a much greater probability of imitating what they saw. So they will grow up and perpetrate abuse against their family members, and they will raise another generation of children who are witnessing domestic violence, and it gets passed on. So as a community, if we work together, collaborate with enthusiasm, and advocate for system response that's effective and appropriate, we have a much better chance of helping our island families live with safety and freedom. So our website address is on the next slide, and I'm happy to answer questions.
There was a question earlier. It's many elderly or those with brain trauma or injury participate in domestic violence and later found to have dementia or other brain abnormalities or electrolyte deficiencies or abnormalities. I guess it's not really a question, but
well, I think it's an important point, because as a community, at least here on Oahu, we are not doing a good job addressing elderly abuse or abuse that happens to elderly or between elderly partners. We need to design some programs and fund some programs that are uniquely addressing the problems of elderly. Their options are even fewer than people who are younger.
yeah. And then there's another comment, great point on the police report. We still find programs requiring police reports as a requirement for service.
Oh, I would discourage programs from that. I think I mentioned there's a lot of good reasons. Indigenous communities, immigrant communities, people who have already encountered the law enforcement that may or may not have been effective. There are many other options for people beyond law enforcement.
And then there's a question, are there services for families of victims?
Another question. So in one of our programs, our Ho'oi Kaika Ohana program, which was designed for our Native Hawaiian communities, we built in an aspect, a phase of the program where we asked the survivors participating to invite any family members that they would like to participate in the program, because there's been harm done often to those relationships. A sister may be wondering, well, why doesn't she just leave him? And has helped her many, many times, and then gets frustrated or gets impatient that she hasn't done what the sister thinks she should do. So if that woman who's participating in our program can invite her sister, we can help her sister understand what the process is like and help them rebuild and mend that relationship. Sometimes it's the mom, and certainly the children participate in that program. But that's an area of community work that I think could be elevated and supported more broadly.
There's in Guam, police reports are required by statute. We need to lobby senators to introduce legislations to change that. And I agree. I would think that with the help of domestic violence centers like yours and all over the country, that would not be as hard a thing to change as we might think.
What does that mean? Required by whom? Police reports are required by whom in Guam? Do you know?
That's a good question. I wonder if it's
To get
to get a
services or
restraining order or to get help from domestic violence centers. Yeah, I
they
think
have an excellent coalition. The Guam Coalition is excellent. Maybe not to break
so
leasing.
Carla says, if we want to break leasing contracts, we must have proof with a police report.
We have been successful in including other things in addition to a police report, like participation with the domestic violence program. So our advocates on staff can write a letter saying this person is a client of ours. And that demonstrates that the person is, in fact, a victim, is receiving services, and it doesn't necessarily require the police report. We did that with our telephone, our cell phone contracts, our rental agreements. So maybe our legislators could go back and amend the statute to include other things in addition to a police report. Sometimes people don't call the police, but will get a restraining order. That's not calling the police. That's a civil action rather than a criminal justice action.
So maybe Carla could contact you for more information, more insights, because she says we can get other forms such as a statement from an organization, but maybe there's an easier way. So
what's a newly implemented law? Well, that's great.
But it sounds like the industry of the renters and the cell phones and the contracts, they aren't understanding. So advocacy is important. Let's see, Renata asked, if someone witnesses active violent acts, is a police visit not indicated? I would say it would always be indicated.
At the very least, what it does is it stops that assault from occurring right now. So it's a good idea to involve the police if you are witnessing an assault. There might be other consequences after that moment, but at least it stops the assault from occurring, unless there's something else you could do. And I am not encouraging you to get involved. We never suggest that somebody try to intervene, because that could be dangerous for the intervener. Maybe honk your horn, maybe yell out the window if you're in a car driving by, maybe call the police. Maybe get the license plate number of the car, see if you can get some information about who's the owner of the car. Maybe you could follow them to make sure that they end up safely someplace, and talk privately to the woman or the person being assaulted. There's some things to maybe think through there. But surely if you're witnessing an assault and there aren't other options, calling the police is a good one.
So does anybody have a case? Well, then let me give the whole group this for insight to see what you can help me with on this one. Dr. Ware says, I've had experience with abused individuals who either look upon abuse as a sign of acceptance and affirmation of love, and others who provoke violence for their gain. These cases are difficult to address from a provider standpoint. Now that's a good question, because in that cycle of abuse, sometimes there's the honeymoon. No. Where they get gifts and stuff. Do they like that? I don't know.
That model, that analysis of abuse has been abandoned many, many years ago. And the power and control wheel is the prevailing analysis. It was discovered that when a program in Minnesota, which was in the forefront of the domestic violence movement across the country, interviewed survivors, lots and lots of survivors, to get an understanding of what they were living with. And what they described were the things that show up on the power and control wheel. And it isn't so much that there's a tension building phase, and then there's an episode of violence, and then after that, there's a honeymoon phase. Those other tactics are occurring sort of on a steady basis. Different kinds of, not all abusers use the same tactics. They don't use them in the same ways. They don't use them with the same frequency, but generally, those other tactics are in play. And there isn't the honeymoon gift-giving reprieve phase any longer seen by domestic violence programs.
Okay, so here's my scenario for input from everybody. I have a 30-year-old patient who comes in every year for her pap smear and regularly for her Depo-Provera. And sometimes her boyfriend comes with her. He's very dominant in the room. So the last time she came in for a pap smear, he came with her. Sometimes, mostly he doesn't, but sometimes he comes. And I thought he was so kind of overbearing that when he went out to the car to fill the meter, and I was doing her pap smear, I asked her if she was at any risk of violence in the home. And she said, well, yes, Joe, for lack of a better name, he does hit me sometimes when he doesn't like what I cook. And sometimes he just leaves without an explanation. We're living together, but I have two kids. One is his, and the other one I had before I knew him. He ignores that child completely, and he puts whatever positive attention on our child, but I don't want to have any more kids, and we have been arguing about that. And so I asked her if she wanted help, if I wanted to give her a reference card, but she had slippers on, and she said he would probably find it and he would probably be angered and not let her come back to my office ever again if he saw that in her things, and he did go through her things sometimes. And I said, well, can I tell you where to look up the phone number if you decide to leave and go to a shelter, because there are shelters where you can go and he won't find you. And she said that she has a friend who the doctor helped recommended marital counseling, and that just actually made things really worse for her. And her husband started beating her more, and she hasn't seen that friend since then. So she doesn't really want to do anything. She says she can take it. Sometimes he's very nice, and so she likes that. So she doesn't want any help right now. But I talked about how it can escalate, and that I worry about her. But she just seemed she seemed like, well, this is what happened to my mom, and this is what I've always expected. And so letting her know that it can be different kind of she wasn't comfortable with it. So I just felt like, when I saw her, I would talk to her. But it's frustrating to know that there is help for people. I mean, it's like having insulin, but somebody not wanting to take it. And so what recommendations do you have, both for the provider to work with the patient, but also for the provider to feel that they're doing their job to help? Does that make sense?
Definitely. Did you want other people to weigh in before I do, or because you said this is a case anybody
Yeah,
can?
no, I always love to hear everybody's comments because they're always
Yeah.
things I don't think of, but I don't see
Okay.
anybody perking up. So go ahead. Unless Gina,
Okay.
you still have your hand up. Was that just from before? Probably from when I made people raise their hand. So go ahead.
Okay, there's a couple new messages here. I don't know, it's sort of hard for me to, yes, okay. There was let me just respond to a previous chat message. Yes, I'm saying that a police report is not required. This was during this conversation about, it's Renata. So were you then saying that a police report is not required to receive care? Yes. Okay. I've got a couple of thoughts. One is we think it's a good idea for all healthcare programs, clinics, practices to set a policy that's clear and on display in the waiting room, in the exam rooms, in the restrooms, that say we meet with our patient alone first at the beginning of every visit. And then the family member is welcome to join after the doctor has time, or the practitioner, or whoever it is, has time with the patient. So the first 15 minutes is, or 20 minutes, or whatever it is with the patient alone with the practitioner. That's a good way for you to continue having conversations with your patient, with the person who comes to see you, to check on the potential lethality, the way the situation is maybe getting better or getting worse. Everybody moves along a path and they're not in the same place every time you see them, even though it feels like nothing has changed. So we've always advocated here on Oahu with our healthcare allies to set that policy so that everybody knows, and it's not you're singling one person out or you're making this one guy feel like, well, what, you're picking on me? It's like, this is the way we do business. The practitioner sees the patient alone, and then we invite you in. That eliminates this whole thing about his being overbearing. Sometimes the patient will come in and he does all the talking and she can't get a word in edgewise. It's not his visit, it's her visit. So that's, not sure if they're likely to seek care elsewhere. Again, if all healthcare practitioners and providers and clinics and practitioners have the same policy, they'll experience the same thing if they go someplace else. It's just an idea. It's a way of us being able to have these delicate conversations with the patient who would never say anything or disclose anything in front of their partner. We have produced lipsticks that look like this. This is not one, but it looks exactly like this, and it has in it, I don't have one here, it has in it resource information so that she can have it in her pocket, or she can have it in her purse, or in her backpack, or in her grocery bag. And he wouldn't think to look at it because it's a lipstick. It's true that a person cannot carry a brochure and can't write that down anywhere, and you probably can't remember it. But the lipstick, and we have lots of them. I'm happy to send you some or drop some off, make them available for you to have in your setting so that you can give it to somebody who you think might need it or definitely does need it. The third thing I would say is, as a reminder, is that what we think or what I think is the right thing for you to do may not be the right thing for you to do. And it may not be at the pace that I would do it, or the pace I would think you should do it. And so we just have to listen with an open heart, suspend our judgment, and continue to provide the information we know is important for that person to incorporate. It is the area of greatest frustration for all community support programs, professionals, interveners. When you think about why a person doesn't leave, you have to remember there's no affordable housing. Most people don't have earn a living wage. Most people are told you made your bed, you lie in it. Most people have made a commitment to a relationship. They want to make it work. He's maybe not always like that. Maybe there's, a lot of love or financial support or religious reasons why they stay in the relationship. There's a lot of variables that are going on that impact a very, very difficult decision. Maybe they've tried to get away before and he's chased them and found them and threatened to kill their mother. I mean, we don't really know all the information. So we want to stand by somebody and listen for cues and be as compassionate as we can muster every time we fear for their safety and we interpret their behavior as accepting the violence. Because most people would prefer not to live with the violence.